Insulin resistance is a big problem these days because more and more people are becoming overweight, not moving around much, and eating poorly. It messes with how our bodies use insulin, a hormone controlling blood sugar levels. When you're trying to improve insulin resistance, it may be confusing if you're making progress. While losing weight can signal that things are improving, not everyone with insulin resistance is overweight. So, it's essential to look at other indicators too. Reversing insulin resistance is a gradual process, and celebrating small victories along the way is essential. In this video, we will uncover the 8 signs that you are beating insulin resistance. Sign number 1. Reduced hunger and cravings. When you're dealing with insulin resistance, your body's appetite hormones can get out of balance. This often leads to constantly feeling hungry and craving sugary or high-carb foods. But as your insulin sensitivity improves, you might find that these cravings start to fade. You may feel more satisfied after meals and not constantly thinking about food. It's like your body is getting back on track and telling you it's had enough without those constant cravings bothering you. Sign number 2. When your HDL, high-density lipoprotein levels go up and your triglyceride levels drop, it's a positive sign, especially in insulin resistance. HDL is commonly referred to as the good cholesterol because it helps take away extra cholesterol from your blood, lowering your risk of heart disease. Ideally, you want your good cholesterol levels to be higher compared to your triglyceride levels. Triglycerides are a type of fat found in the bloodstream. Having a high level of triglycerides can worsen insulin resistance and raise the chances of heart problems. So, when HDL levels increase and triglyceride levels decrease, your body improves its defense against heart disease. The ratio of triglycerides to HDL is an essential marker for insulin resistance. As your insulin sensitivity improves, this ratio tends to decrease, which is good. A lower ratio indicates better metabolic health and a reduced risk of insulin resistance-related complications. However, specific targets may vary depending on individual risk factors and medical history. Individuals with diabetes need to work closely with their healthcare providers to manage their lipid levels and reduce cardiovascular risk through lifestyle modifications, medication, and regular monitoring. Sign number 3. Increase in testosterone levels. For men, observing an increase in testosterone levels is a positive indicator that insulin resistance is being addressed. If you've been experiencing symptoms of low testosterone, such as fatigue, decreased libido, or difficulty building muscle, seeing an upward trend in testosterone levels can signify that your body is responding positively to interventions to improve insulin sensitivity. It's a promising step towards better metabolic health and overall well-being. Before we unveil sign number 4, if you find this video helpful, tap the subscribe button and turn on the notifications bell for more helpful insights about diabetes. Thank you. Now, on to our sign number 4, normal menstrual cycle. A key sign of insulin resistance reversal for women is experiencing a more regular menstrual cycle. Unlike men, insulin resistance affects women's hormones differently. It can elevate testosterone levels in women. While some level of testosterone is necessary, excessively high levels can be problematic. This ties into menstrual regularity because insulin resistance leads to high insulin levels, which inhibit the body's conversion of testosterone to estrogen. In a healthy menstrual cycle, estrogen levels increase around day 14, triggering ovulation. However, when insulin resistance disrupts this process, a rise in insufficient estrogen results in ovulation not occurring, leading to irregular periods. As insulin sensitivity improves and insulin levels decrease, hormonal balance is restored, facilitating a more regular menstrual cycle. Therefore, noticing a consistent pattern in your menstrual cycle can indicate progress in reversing insulin resistance and achieving hormonal balance. Sign number 5, your Homa IR score is getting better. This measure is the homeostatic model assessment of insulin resistance, Homa IR. To determine your Homa IR score, you must consult your doctor for 2 specific blood tests. fasting glucose, and insulin levels. Once you have these values, you can input them into an online calculator to gauge the extent of insulin resistance in your body. While this calculation doesn't provide a definitive diagnosis, it establishes a baseline for your Homa IR score. Monitoring changes in your score over time is essential to transition from a high level of insulin resistance to a healthier range. Sign number 6. Your blood sugar level is becoming more stable. Assessing insulin resistance typically requires visiting your doctor's office because measuring insulin levels at home isn't feasible. However, you can monitor your blood glucose levels at home using a blood glucose monitor available at pharmacies. Although this provides insight into your glucose levels at a specific moment, evaluating insulin resistance requires understanding daily fluctuations, which a glucometer can't capture effectively. Continuous glucose monitors, CGMs, offer a solution by providing real-time glucose monitoring 24/7. While previously limited in availability, CGMs are now accessible to the general public. These devices continually transmit glucose data to your phone, allowing you to track trends and fluctuations. Stable blood sugar doesn't mean a straight line. It fluctuates based on factors like activity, diet, and insulin release patterns. This tool simplifies this data, providing a stability score to help you gauge progress over time. Sign number 7. Skin tags or dark patches are improving. Skin changes, such as dark patches or skin tags, are a potential indicator of insulin resistance. Known as acanthosis nigricans, these brown to black patches commonly appear in skin folds like the armpits, neck, and groin. Skin tags, small benign growths, are frequently found in similar areas. While not everyone with insulin resistance will experience these changes, successfully treating the underlying cause and becoming more insulin sensitive can lead to their fading or disappearance. The exact reason these skin changes occur in individuals with insulin resistance is debated, but it's believed that the growth-promoting effects of insulin may play a role. Therefore, when insulin levels are brought under control, it's expected that skin tags may decrease or vanish. Many of you may relate to this experience. Please feel free to share if you've noticed an improvement or a disappearance of skin tags or dark patches in your skin since making changes to your diet. Sign number 8. Your waistline is shrinking. Being overweight and having a big waist can increase your chances of insulin resistance. This belly fat, known as visceral fat, causes inflammation that worsens insulin resistance. So when your waist gets smaller, it's a good sign that you're getting healthier regarding how your body handles insulin. Generally, having more than a 40-inch waist for men or a 35-inch waist for women is considered too much. If your waist is more significant than that, working to bring it down can improve your metabolic health and help you move away from insulin resistance. Understanding the signs of insulin resistance and its reversal is critical to taking control of your health. From changes in body composition to improvements in blood sugar levels, each indicator offers valuable insights into your metabolic well-being. Monitoring these signs and working towards positive lifestyle changes, mainly a healthy diet, regular exercise, weight management, adequate sleep, limiting alcohol consumption, quitting smoking, handling stress, and keeping an eye on your blood sugar levels regularly can pave the way for improved insulin sensitivity and overall health. Remember, small steps towards healthier habits can lead to significant progress in reversing insulin resistance and reducing your risk of related complications. It's really important to talk to a doctor before you make big changes to your diet or exercise routine, especially if you already have health problems. With knowledge and determination, you can journey towards a brighter, healthier future. Remember to subscribe for more diabetes insights. Thank you for watching, and I look forward to seeing you in the next video.